She's like ready.
Okay. He make you feel uncomfortable. You can look at me and talk to me.
Okay.
So tell me your name and your titles on your thing we just put.
I'm Senate Majority Leader Kimberly A. Lightford. I represent the 4th Senate District, which is parts of the Austin community and Proviso Township.
Can you tell me about, you've been doing some amazing work in Springfield with regard to hospitals, safety in hospitals, and a bill just dropped and passed and was signed. Talk about
Yes.
that and what it's going to do for safety in hospitals.
So I originally started with Senate Bill 1908, which was putting requirements on MCOs, the managed care organizations, to ensure that they paid hospitals who are heavy Medicaid, like safety net and critical care hospitals, in a timely fashion. That bill evolved into this big omnibus Medicaid bill that Senator Staines passed that addressed a lot of the insurities for safety net hospitals moving forward as it relates to clients representing them, providing quality health care, and being paid in a timely fashion. It also addressed a number of other issues with the Department of Health Care and Family Services.
So how is this going to help Loretto? Because we're in trouble and we need this bill. So what do you think, how is Loretto Hospital going to fare with this bill now that it's passed?
So the omnibus bill passed both chambers and will be signed by the governor shortly. So it's a new law stating the status of what should be done with MCOs and safety net hospitals. So if they're not required to drag their feet on making late payments, then Loretto receive prompt payment, which is what's most important.
Just a couple more questions. Where do you see us in the future, Loretto Hospital? Because the community really needs us.
I see Loretto actually expanding, beginning to reach out, getting into more of like community care, providing, scratch that.
I can
I'm trying to think of the name of the health clinics, community health clinics. I think that's what I want to say. I see Loretto expanding far more into the community with outreach, making sure that there's community clinics available, expanding our locations so that we ensure we address the most vulnerable populations in Chicago, particularly on the west side of Chicago. I'm certain that we'll be able to reach those that need us and provide the best quality care that we're able to.
One more question about Mr. Miller. He is a firecracker.
Mm-hmm.
He's probably one of the most amazing leaders I've ever seen, so passionate.
Mm-hmm.
You were part of that hiring process. Based on what we were before he came and where we are now, do you have any comments about the progress we've made as a hospital?
Yeah, as a board member and the vice chairman of the board, we have visions of how we like to see Loretto in the community. And in our search for a new president, we wanted to make sure that our new president put our community first and the people that we served. We hit a trifecta with Mr. Miller. He loves the community, he's committed to the community, and he's dedicated to ensuring that we do better, because when we do better, we all do better. And that's what's most important. One of the initiatives that I brought home was a lot of resources for Loretto. I wanted to bring that up because when you don't have operations, you don't have funds to do those things, then you have cuts in so many critical areas. Well, I was able to secure an additional $5.5 million for Loretto in the budget for this year. So I'm hoping that would allow us to catch up. We've been neglected so by the MCOs that it will allow us to, as a board, go back to the table and restructure the vision on how we like to see things proceed, and then do what we can to continue to expand and grow in the Austin community.
If you had to say one thing to the community, Austin community, about Loretto, what would you say?
I would tell the Austin community that I've spent 2 decades on the hospital board at Loretto, just ensuring that the hospital was viable in the community, that it was strong, that they feel safe coming there to receive quality health care. And I believe we've done that. We've made a lot of changes, a lot of growth over the last 20 years, and now we have a tremendous leader in place that can continue with the vision and the mission of how we want to be to the residents in the Austin community. So it's really important that they feel safe, that they know that they can come to Loretto and receive quality care in a wonderful environment with quality staff. That's really most important.
There's been, you've seen in the news how a lot of these hospitals are closing or almost closing, like Melrose Park. And what do you say to someone in the community who might be nervous about that?
I would say as two separate situations. Westlake Hospital is a private institution, and the Loretto Hospital is a safety net, a not-for-profit hospital serving a different area in the city. And I believe we have a different fight than Westlake had, and they could feel safe and secure in knowing that we'll continue fighting and providing the best service that we can at the Loretto Hospital.
Beautiful.
All right, that's good. Thank you.
Yeah. Yeah, you can't compare Westlake with